But yes, welcome to Dare EM in conference session. We're gonna have some other events outside of conference, like we mentioned, but this is our first conference one. Any questions or anything you want to chat about before Jen Wilsey and Roan Kotri join us and introduce themselves? Does Hannah anything to?
I just want to give a shout out to all of the folks who are our kind of spearhead team who are talking about these uncomfortable things. These are maybe considered by some folks to be controversial, stuff that a lot of people wouldn't touch with a 10-foot pole. So I just want to shout out to us and our department, and especially the folks leading our charge who are tackling the uncomfortable conversations that a lot of people just aren't ready to talk about. So kudos to everyone on the DARE team, everyone who's participating and reading the books. That's all.
All right, well, it's 10 o'clock, so shall I get going? I'm looking for a nod.
Yes, thank you.
Okay, so my name is Jen Wilsey. I want to say hello and welcome to all of you. I'm so thrilled that Hannah and Tanisha and Liz invited Rowan, my co-facilitator, and myself in to spend 2 hours with you on this day in September 2020 for a session called Breaking Our Allegiance with Whiteness, Breaking Our Allegiance to Whiteness, and Committing to Anti-Racism. We have almost 100 really smart people gathered on this call, right, who are really good at using your smart brains. You're medical professionals, you're highly educated, right? You think your way through very well, like you know, the daily challenges and problems that you face. And so it's not to minimize that, it's just to say that we need more than just our brains to do this work. And we know that all of you are here because you know, partly because you were asked to be here, or because this training was provided by Brown, but also because you're in the work you do because you care so much about the health of the people that you care for, right? And so when we gather as mostly white people to do this work, some of the things I just want to name about what's important when we're trying to engage in anti-racism together as white people. One is that it's important to engage in both, like, being kind and loving toward oneself as I realize ways in which I've enacted racism or I've had racist thoughts. It's being kind to myself about that, to know that, like, that's just normal. That's just what this country trains us to be, and also self-critique. So how can we both lean into being caring with one another as we delve into our own racism, as well as developing the skills to critique each other and to challenge each other and to push each other? So it's doing both of those things. Spaces like this are not about looking for ways to call each other racist, right? It's not about a blame thing. It's about recognizing that it's looking at our behaviors. It's looking at what are we doing in our institution? What are we doing in our homes? What are we doing in our communities? It's not about whether you're racist or not. It's about what are we doing, and are the things we are doing contributing to anti-racism, or are they reinforcing racist outcomes, whether we meant for them to or not? Because as white people, and in this country specifically, we are simultaneously taught that racism is like the worst thing you could be. That to call someone a racist or to be called a racist is like the worst label someone could give to me. But we're also taught not to see racism. So we're basically caught in this double bind as white people. Those two things working together basically collude to make it so that we're just complicit in racism. So we're trying to break that apart. This is a place for you to take risks and for you to support each other as you continue this work in your workplace together, for continuing to support each other to take risks. A lot of times people resist gatherings like this because they say, but we're all one. We're all one. I don't see race. And it's true that we are all one, but in reality, we're not. As white people in this country, we are experiencing a very different day-to-day reality than people of color and Black folks and Indigenous folks are experiencing in their bodies in this country daily. And another thing I want to invite during this session is for you to bring thoughts or questions that might be a little embarrassing or that you're unsure of, because as white folks, we can feel often a lot of pressure to be perfect or to say exactly the right thing. And so part of the value of a space that's held by white folks with other white folks is that we can be a little more messy and worry a little bit less about that. And this is a space where we invite you to bring your questions, even if they're not fully formed or you don't know that you have the right words. And I realize that's hard to do in a virtual setting with 100 people, but that's something I want to invite, and also invite you to continue outside of this webinar when you're together in your work. So I also know that because you are all medical professionals who have very smart thinking brains, that you are used to formulas, right? And algorithms. And I know that people who come into almost all of my racism workshops, they want a formula, they want my step 1 through 10, tell me what to do. Why are you leading us through all this storytelling and asking me to ask these personal things? Just tell me what to do. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And I just can't explain enough how I know it's not comforting, but there is no formula for this work. There is no step 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 that I can tell you or that anyone can tell you that's going to give you exactly how to pursue anti-racism. So we are going to take you through a few of the steps that we do think are crucial, which are realizing how each of us has some loyalties or allegiances to whiteness and what that means. And then what does it mean to continually break that allegiance and commit to anti-racism as a lifelong practice. So those are some of the steps, but it's really not like a clear formula. It's much more of a nonlinear path, a spiraling path. Sometimes it's like you learn something and then fall back into an old habit. You learn something, try something new, fall back into an old habit. So that is really truly more of what this work looks like than following a step-by-step process.
So let's come back to you in your role at Brown for a minute, because we only have 10 more minutes together. What would be some evidence of you all as white folks in your work committing to anti-racism in your day-to-day work? Like, what would you see each other doing? What would you see yourself doing differently? Or things that are already happening that you want to see more of? Because I know some of you are in the How to Be an Anti-Racist book club. And one of the things that Ibram X. Kendi says is that there's no such thing as not racist. And many of us as white people were taught to believe in not racist. So in every moment, we're either acting in a way that's colluding with racism or that's anti-racist. So what are some examples of the things you'd like to commit to doing or not doing in your work together? Don't ignore microaggression. Yeah, that's a good one.
Amy, I appreciate what you're bringing up. It's not an individual problem. It's not a single person's fault that they were born into whiteness. That also means the solution doesn't lie in individual people. It requires structural, systemic change. Absolutely. As a single person, it feels like an insurmountable task to make effective change. With the collective power of many individuals, people wanting to make change, then we can make some improvements. So that, I think you're hitting the nail on the head about that connection between personal and systemic. Mm-hmm. Whiteness for me, and whiteness, and this is linked with like patriarchy, this is linked with all of the systems that make up our society here in the US. It's so good at teaching us that we're powerless. Like, it's this huge system and we're just these like tiny little people. And that is true. That is so true, especially if we're just all separate. And so part of this and part of this practice, even part of this practice of like pairing y'all off and talking with each other, is to kind of break that pattern so that we can connect. You know, part of what I think about of what does breaking my own allegiance to whiteness mean is interrogating for myself, who am I beyond whiteness? Who am I as a human being beyond all of these things that I was conditioned to be? Whiteness in so many ways. One of my mentors, Sandra Kim, does a course on healing from internalized whiteness, and talks about the ways that whiteness teaches us to dehumanize, that it teaches us to dehumanize other people, which we can't dehumanize other people if we're not already first dehumanizing ourselves. And she breaks down, we'll send you this resource in a follow-up email, but she breaks down the ways that we dehumanize. But so part of my breaking my allegiance to whiteness is to learn, how have I dehumanized myself? How am I dehumanizing other people? And who am I beyond whiteness so that I can do things differently? It's like building, and Resmaa Menakem talks about this in his book, of like building a white anti-racist culture. And we don't have roadmaps for that. We don't have clear like examples of how to do that. We don't have like clear examples of what white really deeply anti-racist white culture could look like. But we can build that together, like even naming all these things about like, oh yeah, the redlining in my neighborhood, the school disparities, all of that. Normalizing a lot of this in conversation is a small one of many small examples of how we connect, you know, as white folks with each other to build a different culture, to build a different way of being, which then, you know, when Amy, you were talking about how the system is so big and we're like, so it can feel like we're so powerless to change it. When we reach a critical mass, I do deeply believe when we reach a critical mass of white folks that are really actively working to do things differently, that can throw off a system, that can actually break some of these things. It's our separation and our isolation and then our just like automatic complicity that helps uphold all of it. Yeah, would you add anything, Jen? Or about anything else? I know people are texting a lot.
Well, yeah, there's some good stuff in the chat. I just want to emphasize, because Jared put something that they thought was a small thing in terms of bedside practice as a doctor. I'm guessing, I don't know if you're a doctor or what your title is, Jared, but Jared wrote, I noticed I was taking a few extra moments to connect with patients and or families that are primarily white and or affluent, subconsciously finding them relatable perhaps. I'm trying to actively divert those minutes to attend to patients that are Black, brown, or speak another primary language, ask about their families, their lives, etc. It's actually felt really positive, although it's a trivial thing. So it's not trivial, and I just want to really affirm that is like, if you take anything away from this, it's just practicing and building strength in those muscles to notice where am I caring more or putting more of my attention or into the humanity of white people, and where am I not completely affirming the humanity of Black and brown and other folks. I know that just in the murder of the Black person I mentioned in my hometown, Daniel Prude, this is a conversation I've been having with my parents. Like, literally, they couldn't see, they were having a hard time seeing the police brutality in this situation because I really, you know, their capacity to see this Black body as fully human and fully worthy of dignity is underdeveloped. Like, and I've been actively developing that now for 20 years, but like still, I can prioritize the comfort of white people. I can prioritize the well-being of white folks. And we can stop that. Can we help each other notice these rotten tomatoes, and can we recalibrate ourselves? I think this is what it sounds like a lot of you from what's happening in the chat are wanting to do more of and to support each other in. So hopefully over the last hour, we have normalized this idea that whiteness is something that we were assigned, many of us on this call, not all of us, that all of us in the United States are asked and forced and reinforced to build an allegiance to whiteness, even if we're people of color. Often that is something that is pounded into us from our textbooks and in our institutions, and folks of color have to conform in ways in majority or predominantly white institutions, of which yours is. You work in a predominantly white institution. What are the ways in which your colleagues of color may be having to conform that you're not aware of? Where are white dominant cultural norms? They're going to be even harder for you to see because your institution is so white. So just things for you to think about as you move forward, and not to jump to solutions, but this is hopefully supporting you in beginning this conversation as a team and as colleagues. I know that Tanisha and Hannah have a lot more planned for you, and Liz, over the course of the year, to keep deepening these skills and continuing these conversations and supporting you to really unify around anti-racist action as an institution.